Hey Cal HOSA, this is our emotional well-being challenge, and our project name is running on no REM. Now, these are chapter details, and this is our table of contents.
We selected the theme How Chronic Sleep Deprivation Fuels Emotional Numbness, Irritability, Burnout, and Declining Mental Health without being recognized as the root cause because sleep loss is one of the most widespread issues among teenagers, yet it is rarely treated as a mental health concern. In high achieving environments, exhaustion is often seen as expected, which causes students to overlook how chronic lack of sleep directly builds emotional burnout and mental health decline. As a group called Running on No REM, we chose this theme to expose sleep deprivation as a hidden root cause rather than just a side effect of stress and to shift how people value sleep in relation to emotional well being. We want to do so by making our presentation towards high school students since they are highly prone to burnout, sleep deprivation, and stress due to a lack of sleep. This way, we can get our message across of how getting at least 7 to 8 hours of sleep each night can improve mental well-being during such stressful time for many high school students. This is especially essential as many people we know, including ourselves, fail to get 7 to 8 hours of sleep every single day. This impairs our ability to function in school and in turn worsens our already impacted mental health.
When thinking about sleep deprivation, many students believe it is not a serious issue. Common misconceptions include the idea that a lack of sleep does not affect the mind or the body, that mood swings are uncommon, or that sacrificing sleep is necessary to keep up with homework and maintain good grades. However, sleep deprivation has far more serious consequences that many students do not realize. Chronic lack of sleep impairs thinking and decision making. It increases frequent mood swings and emotional outbursts. It disrupts important body systems and negatively impacts mental health and overall well being. It also interferes with the brain's ability to learn, store, and recall information, which directly works against the academic success that students are trying to protect. Some common late night behaviors for high school students include scrolling on a device, staying up late to finish homework or study for a test, procrastinating sleep, stress, worry, or other mental health challenges, and unhealthy food consumption. These behaviors are often viewed as normal or harmless, but over time they contribute to chronic sleep deprivation that has serious and sometimes irreversible consequences. Consistently losing sleep disrupts emotional regulation, weakens concentration, and increases irritability and burnout, which can significantly impact both mental and physical health.
These late night behaviors don't just make students feel tired, they have real measurable effects on the brain and the body. According to the Sleep Foundation, staying up late disrupts the hippocampus, which impairs memory consolidation and makes learning less effective. Medical research summarized by Baylor Scott and White Health explains that sleep deprivation reduces the brain's ability to adapt and learn, limiting synaptic plasticity. Studies from the Institutes of Health shows that lack of sleep overactivates the amygdala while weakening the prefrontal cortex, leading to the increased irritability and poor emotional regulation. Physically, insufficient sleep raises cortisol levels and inflammation, which contributes to headaches, fatigues, and reduced daily functioning. Together, these effects explain why sleep deprived students struggle academically, emotionally, and physically.
Now, one symptom of sleep deprivation is time blindness. This is when the brain struggles to accurately perceive time and manage time. Now, when someone is sleep deprived, time can feel distorted, with minutes passing by faster or slower than expected. This makes it difficult to estimate how long tasks will really take, such as homework, studying, or even getting ready in the morning. Because of this, deadlines do not often feel real until they become urgent, leading to last-minute work. This ongoing cycle increases stress and anxiety and reinforces procrastination, not because of laziness, but because the brain is tired and it struggles with planning, prioritization, and effective time management. Now, another symptom of sleep deprivation is cognitive delay, which means that the brain processes more information more slowly than normal. Now, when someone is sleep deprived, it takes longer to understand instructions, respond to questions, or make decisions. Now, simple tasks may feel harder and thinking clearly will clearly require more effort if you are sleep deprived. Now, this slowed This slowed processing can affect learning, memory, and reaction time, especially in school settings. Now, as a result, students may appear distracted or unfocused, but it's not because they aren't trying. It's because lack of sleep slows how the brain actually functions. Now, over time, this can lead to frustration, lower academic performance, and increased stress. Now, this reinforces a cycle where poor sleep continues to negatively impact daily functioning.
Sleep deprivation affects many people, but small changes can make a big difference. Exercising regularly and limiting caffeine, especially later in the day, helps prepare your body for better sleep. Creating a consistent sleep schedule trains your body to rest and wake up at the same time each day. Avoiding phone use and limiting light exposure before bed allows your mind to wind down naturally. Finally, meditating before bed can reduce stress and help you fall asleep faster and sleep more deeply.
So how this benefits our team. This project trained me to identify sleep deprivation as a root cause rather than treating surface symptoms, a skill essential for accurate diagnosis in the medical field and long-term patient care as a future health professional.
This project helped me become a better student by teaching me the real downsides of chronic sleep deprivation and how it affects emotional well-being, focus, and motivation. Learning about this topic motivated me to take my own sleep habits more seriously and recognize how proper rest actually impacts my academic performance and mental health. Also, creating this project encouraged me to educate others, just like now what we're doing, about the effects of sleep deprivation, especially after seeing firsthand the difference that adequate sleep can make in a person's mood, energy, and the ability to function.
By tracking my own sleep, I learned how daily habits affect health, helping me develop the self awareness and accountability needed to guide patients towards realistic lifestyle changes.
This project strengthened my ability to recognize behavioral patterns and emphasize early education and prevention to reduce long-term mental health risks in patients.
By being able to analyze and evaluate data, this project improved my evidence based decision making skills, and this project taught me more about simple interventions for sleep deprivation in order to help future patients and myself.
Now, before we play our PSA, we created this project because sleep deprivation is often silent and normalized. Even though it deeply affects emotional well being, feelings like numbness, irritability, and burnout are frequently ignored or misunderstood, especially in students. Now, since these effects are rarely talked about, we chose to create this PSA that reflects how exhaustion and emotional decline often go unnoticed. Now, this film is meant to visually show what chronic sleep deprivation feels like and remind people that sleep is not optional. It's a silent film, so it can fully communicate how a student really feels without words, allowing the emotion and the experience of sleep deprivation to speak for themselves. What is this low score? Oh.
According to the Centers for Disease Control and Prevention, the National Institutes of Health, and the American Academy of Sleep Medicine, sleep deprivation among teenagers is widespread and medically serious. The CDC reports that nearly 70% of high school students get less than 8 hours of sleep on school nights, even though teens biologically need 8 to 10 hours. Over 40% get 6 hours or less, creating a chronic sleep deficit. Research shows that sleep deprived students are twice as likely to struggle with attention, memory, and learning. While the NIH links insufficient sleep to increased stress and impaired emotional regulation, long term data also connects chronic sleep loss to higher rates of anxiety, depression, burnout, and risk taking behaviors. These statistics show that sleep deprivation is not just a lifestyle choice, but a serious public health issue that directly threatens emotional well being, mental health, and academic success.
All right, so this is the survey that we conducted with our student population and students from outside of our school before we implemented our strategies to improve emotional well-being. This survey here on the top shows that only 60.7% of students get 3 to 6 hours of sleep, while only 8.4% of students get 10 plus hours of sleep. The average recommended amount of sleep for this age group is 8 hours of sleep, and it clearly shows that not many people actually get this amount of sleep. Additionally, we can see that over 74.8% of the student population that we interviewed showed that not getting enough sleep, impacts their well-being drastically. This shows that sleep deficits not only impact the things that they talked about on the last slide, but also students' well-being and many other things. So our main goal of this project was to educate students on the impact of sleep deprivation. To achieve this, we used a multitude of approaches, such as creating an Instagram account that shared tips and tricks through different posts in order to combat sleep deprivation. This account was also not just limited to our school, but reached many other schools. Furthermore, we went around our school and presented to different classrooms during freshman mentorship periods in order to remind students of the importance of sleep and how it can affect them during their day-to-day life. Specifically, we used a separate presentation that contained less details regarding HOSA in order to create a long-lasting impact on students to ensure the presentation was relevant towards them. This allowed students to reflect on their own sleep behaviors and actually become incentivized to make a change. This all shifted sleep from an abstract health concept to a measurable behavior by increasing motivation.
Now, to evaluate whether our project was successful, we used both quantitative and qualitative data collection methods, focused on awareness, attitude change, and real life impact. After sharing our educational content and PSA, we directed students to our Instagram page and posted evidence based tips related to sleep and emotional well being. We then distributed a follow up survey to measure whether this content influenced students' daily lives. In our post-presentation survey, students were asked whether the tips posted on Instagram page helped them in their day-to-day lives. Out of 88 responses, 72.7% reported that the content did help them, while others reported partial impact. We also collected open-ended responses to capture deeper insight. Students reported feeling more relaxed, less stressed, calmer during the day, more focused on everyday tasks, and less relied on energy drinks, which indicates behavioral and emotional changes rather than just increased awareness. By combining numerical data with with personal reflections, we were able to assess both measurable outcomes and emotional well-being shifts. This evaluation method allowed us to determine that our project was successful in increasing awareness, improving attitudes towards sleep, and encouraging behaviors related to emotional well-being. All in all, we wanted to ensure that every single high school student who was exposed to our presentation was able to get 7 to 8 hours of sleep, which was successful.
Now, these are our sources, and thank you so much, Cal HOSA. I hope you have a really wonderful day.